Have you ever imagined a world where machines can not only assist, but also perform complex surgeries on living beings without human intervention? The lines between science and ethics are blurring at a dizzying pace, leading us into uncharted territory where robots can make life-changing decisions with astonishing precision. We are on the cusp of a technological revolution that could forever transform healthcare and medicine. If you want to stay abreast of these amazing advances, and think with us about the implications of a future dominated by intelligent automatons, don't forget to subscribe to our channel, like this video, and leave your comments below. The revolution is here, and the future has never been so fascinating, nor so disturbing. We are crossing a critical threshold in technological and ethical evolution, the moment when robots and automatons not only assist in medical tasks, but also begin to perform complex procedures on living beings, including organ harvesting. The possibility of machines playing such a decisive role in the life and physical integrity of living beings raises profound questions about the limits of science, responsibility, and the very nature of medicine. The frontier of automation in surgery. Advances in cybernetics and artificial intelligence, AI, have allowed automated robots to enter areas previously considered exclusively human. From factory assembly robots to office assistants, the presence of machines in our lives is now omnipresent. However, the idea that a robot can perform a surgical operation on a living being, even more so, remove an organ, goes far beyond simple technical support. It is approaching an ethical and practical redefinition of medical care. To what extent are we willing to trust these machines? The history of robotic surgery has been marked by initially surprising milestones that were later integrated into medical practice, such as the Da Vinci systems that allow surgeons to perform procedures with greater precision thanks to robot-assisted laparoscopy. But the difference now is that, in some cases, the robot is operating without the constant presence of a human, making decisions in real time and adapting to circumstances in a way that, until recently, was considered impossible. The pioneers, robotic surgery on living beings. The first notable example occurred in January 2022 with STAR, Krieger's smart tissue autonomous robot. This robot, equipped with advanced technology, successfully performed laparoscopic surgery on a pig, a delicate operation in which a gallbladder was removed. This achievement was not only a milestone in biomedical engineering, but also a symbol of how far robotic autonomy can advance in fields requiring precision, sensitivity, and clinical judgment. However, this machine operated under strictly controlled conditions. Its autonomy was still limited. It followed a rigid plan, operated in highly automated environments, and relied on clearly delineated and pre-marked tissues, much like a computer program following specific instructions, rather than dynamically adapting to the complexity of the living body. The true revolution. Robots that learn and adapt in real time. But that reality changed radically with the development of robots equipped with advanced AI, capable of learning and responding in real time. A fascinating example comes from Johns Hopkins University, where a team of researchers enabled a robot trained with images, videos, and surgical data to achieve an unprecedented feat, performing a gallbladder removal in a live pig without human assistance. This robot, called SRTH, resembles a surgeon's assistant endowed with artificial intelligence and sensitivity. Its real-time adaptation capacity is astonishing. It can respond to voice commands, self-correct minor errors, and adjust to a patient's anatomical variations, even when the scene becomes more chaotic, such as when the surgical field becomes covered in blood, or when the visual image changes rapidly. The machine learns in the middle of the operation, correcting and perfecting itself, using real-time feedback to improve its accuracy. What's truly disturbing and revolutionary is that these robots don't just follow pre-programmed instructions. They respond to commands, adjust their behavior based on experience, and make decisions that only humans could have made in the past. This marks a key transition in medicine, toward an era in which machines can perform complex operations with minimal or, in some cases, no human intervention at all. What does this mean for the future of medicine and ethics? The integration of AI into surgery opens up a universe of possibilities. On the one hand, it increases precision, reduces human error, and has the potential to perform procedures that were previously considered too risky or simply impossible. On the other hand, it raises unprecedented ethical dilemmas. What if a robot makes a mistake in an autonomous operation? Who would be responsible? To what extent can we allow these machines to make decisions that affect people's lives? For example, the development of AI that can predict medical complications or even anticipate a patient's death with high accuracy rates raises both fears and hopes. These systems can alert doctors early, enabling preventive interventions, but they also raise questions about privacy, autonomy, and trust in machines that make crucial life or death decisions. The possibility that a robot, after learning in real time, could decide to perform or stop an operation based on its autonomous judgment raises philosophical and moral questions about the relationship between humans and machines in the medical field. Furthermore, advances in robots capable of performing surgeries without human assistance also suggest a future in which they could replace human surgeons in many tasks. Imagine a scenario where highly automated hospitals, equipped with multiple robots learning and perfecting procedures, could provide surgical care in remote locations or in areas with limited availability of specialized medical professionals. This could save countless lives, but it also poses risks of overdependence on technology and the loss of traditional medical skills. Ethics in the age of surgical robots. A crucial debate arises from the role of humans in this process. Should physicians remain the final supervisors, or could robots eventually be responsible for the entire execution of the procedure? The answer to this question not only affects clinical practices, but also involves a thorough review of laws, regulations, and ethical responsibilities. For example, in cases where a robot has the ability to decide on whether to continue or cancel a procedure, who would be responsible if something goes wrong? The robot manufacturer, the medical team, or the AI system itself? Furthermore, the transparency of algorithms and the ability to understand how these machines make decisions will be vital to ensure proper governance and social acceptance. Examples in other fields. In the field of cardiac surgery, some robots already perform procedures with extraordinary precision, minimizing risks and improving outcomes. However, these still require the supervision of human physicians. As autonomy increases, the door opens to the possibility of fully automated surgery, in which the robot decides, adjusts, and executes without human intervention. Another area that illustrates the complexity is personalized medicine. AI systems that learn the anatomical and physiological characteristics of each patient in real time could perform highly precise and tailored surgeries. However, this also entails new challenges in data protection and ensuring that automated decisions are safe and ethically acceptable. The significance of real-life examples and their future implications. Reality is already beginning to reflect these potentialities. Successful autonomous surgery on live animals by a robot equipped with advanced AI is just the beginning. Some hospitals are already experimenting with AI-assisted surgeries, and in a few decades, perhaps assisted or even fully directed by intelligent robots. This advancement not only changes clinical practice but also the social perception of medicine. To what extent do we trust a machine to make decisions that affect our lives and well-being? Is it ethically acceptable for a robot to decide whether or not to remove an organ without human supervision? Are we preparing to accept that machines can, in certain cases, replace doctors? Final reflection. The development of autonomous robots capable of performing surgical procedures on living beings poses a series of challenges and opportunities that force us to reconsider our views on medicine, ethics, and our relationship with technology. The line between assistance and supervision and independent execution has blurred, and today, more than ever, we must consider the implications of delegating vital decisions to machines. Accountability, transparency, and ethical oversight will be the fundamental pillars for integrating these innovations in a way that is safe and beneficial for all of humanity. Are we perhaps on the threshold of a new medical era, or are we crossing a line that must not be overstepped? Only time, along with deep ethical reflection, will provide the answers. What we have seen today is only the beginning of an era in which robots could perform medical interventions autonomously, challenge the boundaries of ethics, and transform our lives in ways we can barely imagine. The line between innovation and risk is becoming increasingly blurred, and we are now faced with questions that require deep reflection. To what extent should we let machines decide our health and our destiny? The future is uncertain, but one thing is clear. If you want to continue exploring these fascinating topics and be at the forefront of the technological advances that are redefining medicine, subscribe to our channel, give it a like, and share your thoughts in the comments. Human history is being written now, and you too are a part of it.
If you enjoyed this video, give it a like, share it with your friends, and subscribe so you don't miss out on future ideas that challenge us to think outside the box. We'd love to hear your thoughts in the comments below. Until next time, and don't forget to always maintain that curiosity that drives progress. Also, explore even more fascinating content on our channel. From life-changing tips and cutting-edge technology, to the mysteries of spirituality, travel to various countries, delicious recipes, health hacks, and language learning, there's something here to spark your curiosity and elevate your life. Dive in and discover a world of knowledge awaits us.